As far as HIV is concerned, Black Africans in the UK face health inequality of monumental proportions. This is because Black Africans make about 1% of the country's population, yet contribute more than 30% of people who access HIV-related services in the NHS. In response to this huge health inequality, we have organized ourselves as a community to be able to respond through a HIV prevention service called the Love Safely service. The Love Safely service uses the outreach model. In the service, what we do is recruit members of the community who are not necessarily from a health background. We then train and skill them up so that they are able to go out into the community, and then they receive support to be able to undertake community-based HIV awareness raising, informing people about the range of services available and the support that they could get.
I think outreach models are a very important way of taking messages to people who don't access services, because if they're not accessing services, there's no other way to reach them. So they're an essential model.
The model that the Love Safely programme uses is a particularly good way of outreaching to communities. They use a questionnaire, which is a good way of actually beginning to talk about a topic that's quite sensitive and that people may not feel comfortable to talk with. By taking something and using quite a factual model, is just a kind of icebreaker really, and we know that this has been very effective. The outreach workers who go through the questionnaire with clients are highly trained, have a lot of knowledge around HIV, and people don't always feel comfortable to come to the NHS. We know that, whether that's because of their cultural barriers, language barriers, or just the fear of stigma, particularly around a condition like HIV. So we find it a very useful way for us to get out there into the communities.
We have decided, in order to deliver the Love Safely effectively, to form a partnership called the West London African HIV Prevention Partnership. The partnership enables us to have a reach that is not possible to realize if each organization was working on its own.
We decided to be part of Love Safely because of the way the project is delivered.
Over the 10 years that I've been working with the Love Safely project, I've benefited from the training, which equipped me and also helped me to go for further studies. This project benefits the community because we go out there to reach the isolated and hard to reach people, because most people don't access services in the African community, as you know. People wait until they collapse and are taken to hospital by an ambulance. But our project helps people to monitor their health so that they don't have to wait until they are very badly off.
The NHS doesn't know what the answers are for everyone. And so when we design our services, we like to co-produce them with patients, with members of the community, with community groups, so that we make sure they're ones people can use effectively from the very beginning.
The partnership has now been running for about 10 years, and over those years we have been able to train well over 100 individuals. What we've also been able to do is to establish partnerships with Acute NHS Trust so that it's easy for us to be able to refer people, and people are able to access services much more easily.
We have managed to take in a couple of guys, and the clinic is a bit full now, and most people have had their tests done. Some people are just walking in for free condoms, and the nurses are assessing as they give that. So basically we are doing very well today.
We need stuff like this to help the youth, so keep them aware. And I'm here today to get some free condoms. But yeah, that's how it is, man. Just keep it safe, have some safe sex.
It's very helpful. It's very hard to go for us to go actually to the clinics and NHS, because at the moment it's quite big queues, and not only that, you have to book an appointment and wait. And when you're actually working at the same time, it's quite hard for us to book an appointment and go to the appointments itself. So it's great to have just around the corner, and I can just come in. It takes just a few minutes to my lunch break and go back to work. So thank you very much, NHS.
And I've got that confidence that, okay, I can teach a lot of people who don't know that, and I enjoy it a lot.
It makes the other party that receives it, people in the community feel that, they've been, honored, they've been acknowledged.
I think this has been really helpful for Africa and other organizations in partnership. The coordination as well within the Love Safely project has been great and is always great.
And I have found it a very enriching experience. It's been tremendously empowering.